What is the difference between tendinitis and tendinosis? And what is the best treatment for them? There are so many people advertising miraculous creams, vitamins, injections, laser, shockwave, ultrasound, braces, splints, and exercises. But what is the most effective way to treat a tendon problem? Today I'll answer 7 questions. What is a tendon? What is tendinitis? What is the difference between tendinitis and tendinosis? Why tendons take so long to heal? Can a tendon problem be seen in an X-ray, CT scan, MRI, or an ultrasound? What are the treatments for tendinitis and tendinosis? And is there hope for tendon regeneration in older adults? So let's talk about tendinitis and tendinosis today. What is a tendon? Tendons are structures that connect the muscle to the bone. Next time you see a chicken drumstick, pay attention to the tendon structure. It is this white, thick and round structure between the red meat, the muscle, and the bone. It enables the muscle contraction to move the bone and do the joint movement. Many tendons are very close to the skin. You may even palpate your own biceps tendon in front of your elbow. You see how thick and round it is? You can see the tendons of your forearm muscles in front of your wrist, and the largest tendon of our body is the Achilles tendon behind your heel. The structure of tendons is basically type 1 collagen fibers. They form a triple helix, which makes them very strong and resistant to rupture. Tendons are living structures. They are not like hair, a dead piece of a long protein. Tendons are embedded within a matrix that contains cells that brings them nutrients. Tendons undergo constant remodeling. They are live biological tissues, and because they are alive, they can heal. The healing process of a tendon occurs in 3 phases: an inflammatory phase, a proliferative phase, and a remodeling phase. Actually, these phases do not occur in sequence, they overlap with each other. Tendon injuries and diseases can happen for a variety of reasons, but the most common are sports related due to a poor technique or overload, microtrauma due to overuse, or sudden stretch and load like a rapid use. These are usually seen in people who have not properly conditioned or had an already damaged tendon. And last, they can be compressed, making them more vulnerable to irritation. A common type of tendon compression is in the shoulder impingement syndrome. Tendinitis and tendinosis are examples of diseases of the tendons. The medical term is tendon pathology, and we use the short form tendinopathy to say the tendon has either a tendinitis, a tendinosis, or both. Tendinitis ends with itis, which means inflammation. For example, diverticulitis is an inflammation of the diverticulum of the bowels. So tendinosis ends with osis, which means is a chronic, non-inflammatory degenerative condition. For example, diverticulosis is a disease characterized by the presence of diverticula or pouches in the bowels without inflammation. Tendinitis is an acute inflammatory condition, and if we examine the tendon, we will see signs of inflammation, which are red, hot, painful, and swollen. In contrast, in tendinosis, we don't see inflammation, but a state that the collagen in the tendon is disorganized and degenerated. Tendinosis does not cause swelling, redness, or heat. It may or may not be painful. Tendinitis and tendinosis are the most common types of tendinopathy, and the main contributing factor to tendinopathy is exposing the tendon to excessive mechanical forces that are bigger than the ability of the tendon to adapt and remodel itself. We call this too much too soon. Muscles heal fast. They have a lot of blood supply, and usually a muscle tear heals in about 2 to 4 weeks. Bones also have a good blood supply, not as much as muscles. Bones typically take 4 to 6 weeks to heal if the bone can be immobilized. And they may take a little longer if you can't immobilize them, like the ribs. But for tendons, they may take up to 6 weeks for tendinitis and up to 6 months for tendinosis and up to 12 months if they have a severe tear and require surgery. When we examine a patient, we can detect inflammation or tendinitis. We touch the tendon, apply pressure, compress it, or stretch it, and there are special tests that we can do to reproduce the symptoms of pain or weakness. When we examine the patient, if there is a tendon rupture, we will notice that the muscle is disconnected from the bone, and the person will lose the ability to move that joint properly. This is the typical Popeye's arm, where there is a rupture or tear of the biceps tendon. It is interesting to note that most people can still function well with a ruptured tendon and only need a few days of simple analgesics to relieve the initial pain. Tendon problems like tendinitis and tendinosis are usually visible on ultrasound or MRI imaging studies. Tendons are not seen on X-rays or CT scans. Now, some researchers looked at the Achilles and patellar tendons of 91 people using ultrasound. They classified these tendons into normal or abnormal. Abnormal tendons could have signs of tendinitis, tendinosis, or both. And they found that abnormal tendons were thicker, but this was because they contain not only the tendon fibers that were abnormal, but actually the tendon contained more healthy fibers compared to normal tendons. What does this mean? It means that when a tendon suffers an injury or disease, it will heal itself, and it will increase the number of healthy fibers within it, so it can tolerate and benefit from loading it next time. Remember, tendons are living organisms and they heal. There are many studies showing that normal tendons can hurt, and muscles with tendinitis or tendinosis may not have pain at all. Here are some examples. In this study of 96 people without any shoulder pain, they found 34% had a rotator cuff tear on an MRI. In this other study of 100 asymptomatic non-athletic volunteers, 14 had complete tear of the rotator cuff, 22 had partial tears, and 18 had tendinopathy on an MRI. Another study of 411 asymptomatic individuals showed 51% of participants who were older than 80 of age had a rotator cuff tear on ultrasound. Another tendon that has been studied is the patellar tendon. There are some very large studies that included asymptomatic individuals. One of the largest studies looked at 1457 tendons and found 11% had tendinopathy. Another very large study with 282 people who did not have any knee pain found 16% had tendinopathy on image. So we need to be very careful not to associate these findings on an MRI or ultrasound with pain or functional impairment. Now that you learned how doctors diagnose a tendon problem, what are the best treatments? In the acute phase of tendinitis, we use ice, non-steroidal anti-inflammatory drugs, NSAIDs, either in topical creams or tablets by mouth. In some cases, an injection of steroid anti-inflammatory substances like depomedrol is necessary. In chronic phases, when there is tendinosis and tendon tear, the treatment should focus on restoring function, primarily through exercises and shockwave therapy. I recommend you to see a physiotherapist, as they will assess your particular situation and determine which exercises are good for you, how much mechanical load tolerance you have. Because if you apply low load, it will not help the tendon to heal. And if you apply too much, it can damage the tendon even more. Also, you will need progressive rehabilitation because the tendon adapts and remodels. So you need to progress to stimulate tissue healing. This progression usually starts with isometric loading, then eccentric loading, and then a slow, heavy load. For people who practice sports or athletes, they need to be trained to introduce sport-specific loads and movements. Tendons heal, but the new tissue that is formed around the tendon is a kind of fibrovascular scar and does not have the same strength and resistance as the native tendon. It has an inferior mechanical biomechanical composition. But there are many scientists trying to develop strategies and materials to improve the natural healing response, like injecting cells, scaffolds, bioactive agents, and mechanical stimulation. These are showing promise, both in the laboratory and with patients. However, there are still many challenges and uncertainties about these new treatments. This video is not intended to provide medical advice. It is for educational purposes only. If you have any emergency, please go to the nearest emergency department or call an ambulance. If you know someone who needs to watch this video, send it to them right now. Don't forget to subscribe to this channel and turn on the notifications so you can be alerted every time that I post new videos here. Thank you for watching today. Goodbye.